Hey everyone, I'm back again, and today I'll show you how to take blood pressure using your manual cuff. And to take this blood pressure, you need this cuff and also your stethoscope. So I created one more video to show you how to use stethoscope. Okay, so you can watch that video just to get an idea. So I got this manual blood pressure cuff from my school when I started nursing school, and since then I'm using this blood pressure cuff to take blood pressure of my family members. And I feel like this is more reliable than the blood pressure machine, because sometimes when it's faulty it will give you wrong reading. And in this blood pressure cuff there's only one thing sometimes that creates issue is this dial. Sometimes this needle that you see in between, it's not here in the middle, so you need to make sure your needle is in the middle. If it's not, so you just need to remove this pipe from here, and then you can use a screwdriver and you can bring this needle back in the middle. Okay, so in this dial, as you can see, there are so many numbers. So with this dial you can only get even reading, because there are numbers which starts from 20 and then 30, 40, and so in the beginning you can see 20 and then 22, 24, 26, 28 and 30, and that's how you can get even reading with the manual blood pressure cuff. But with the automatic one you can get odd reading. So make sure you know how to read it when you start taking blood pressure. Other important thing is this cuff. This is the regular size cuff, and there is larger size and smaller size in different colors. So you need to know what kind of cuff you need for your patient. Okay, so this is the regular size cuff, and as you can see, there are two arrows, right arm and left arm. I'll show you how to use it. So to place the cuff on your arm, you need to know where is your brachial artery and where is your radial artery. So to check the radial artery on a patient, I will demonstrate on myself how to check it. So usually your radial artery is where your thumb is, okay? So when you try to press it, don't press it too hard, just lightly, and you will be able to feel your pulse here, right here where your thumb is. And you need to move diagonally to see where is your brachial artery. B is for brachial, B is for body, and it's always close to the body, so that's how you would know this is your, and I can feel it. You can try to check, you will be able to feel that too. Okay, so this is how your cuff should look like on your arm. There should be a finger gap in between your arm and your cuff, and the arrows that you have on your cuff, you will see these arrows on most of the cuffs, or it says arrow with artery. So this arrow should be on your brachial artery. So that's where I felt my brachial artery, and you can see this arrow is facing towards it. And your cuff should not be too tight, otherwise it's going to give you wrong reading, but it should be wrapped around properly so it's not loose and it's like coming off of patient's arm. Yes, so these are some of the rules to take blood pressure. We need to avoid smoke, exercise, consume caffeinated beverages like tea or coffee, and alcohol within 30 minutes of taking the measurement. A full bladder can increase blood pressure, so we need to ask patients if they want to go pee. Sit quietly for 5 minutes before taking the measurement. Do not talk, watch TV, or use phone while taking the measurement. Okay. Sit with your back straight and supported, feet flat on the floor. Do not cross legs or ankles. Rest arm on the flat surface such as table with the cuff at heart level. Place the cuff on bare skin, not over clothing. So if they're wearing heavy clothing like sweater or sweatshirt, or something where you cannot feel pulse, they need to either take it off or they need to take it up to their shoulder so you can take the blood pressure. Or if they're wearing thin clothing where you can actually feel the pulse, that's okay. You can wrap the cuff on that thin clothing, but they shouldn't be wearing heavy clothing. The cuff should be snug but not too tight. There should be one finger gap between the cuff and arm, with the bottom edge directly above the bend of the elbow. I'll give you a demonstration how it looks like. Choose an automatic cuff style or upper arm monitor. avoid wrist monitors. These are generally less reliable than upper arm cuffs. I've had patients who don't like taking blood pressure because it's uncomfortable. So they used to ask me to take it on their forearm. So we need to inform that hey, taking blood pressure on your forearm, it's not always reliable because it's not gonna give us good reading. So we recommend taking blood pressure upper arm. Ensure proper cuff size. If the cuff size is too small, it can artificially raise your blood pressure reading. Timing. Take measurement at the same time each day. For example, in the morning before breakfast, in the evening before dinner. So for example, if you taking blood pressure for your family member, they are already diagnosed with hypertension, or their blood pressure is always high and doctor asks you to take readings for 5 to 10 days. So make sure you take that measurements at the same time each day, in the morning before breakfast and in the evening before dinner, um, to get the proper readings. And take multiple readings, take 2 or 3 readings if you need to, but always make sure there is a time gap in between. And we need to keep the record of those readings with the date and time, to track your blood pressure. Okay, a single high reading is not cause of immediate alarm. Take the reading again. Um, so when your blood pressure is consistently high, higher than 130 systolic and 80 diastolic, contact your healthcare professional. If your blood pressure is higher than 180 by 120, wait a minute, wait for some time, at least give them 5 minutes, let them sit, rest, and then take the blood pressure again. If it remains high, we need to contact doctor immediately. If you have symptoms like chest pain, shortness of breath, or numbness, or tingling, we need to call emergency services, which is 911. Um, and these are some of the rules that we need to follow to take blood pressure. As I mentioned before, your cuff should be on your arm like this with the finger gap in between, and this arrow should be facing your brachial arteries. And I put my dial here so that I can easily see that. Okay, so now we're gonna start pumping your cuff, and you should go till 160 and place your stethoscope on your brachial artery and slowly release the air. Okay, I heard my first pulse. And there was the second one. And then you can release the air. Okay, there should be a couple things that you have noticed. When I said I got my first reading, um, even before that, the needle was bumping. Don't let it trip you, because that bump is when dials start reading the pulse. So your brachial artery will get a blood flow back when you start releasing the air, and then your dial will start reading that blood flow. So the first actual reading is when you hear it from your stethoscope. Wait for that. The first reading would be systolic reading, which is your heart contraction. So when your heart starts squeezing S for systolic. And the last reading, so you will hear pulse, 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 and then it's gone. When it stops, the last reading is diastolic, when your heart start dilating. D for dilating, D for diastolic. That's how I used to remember. You need to practice to actually start hearing the pulses, because when I started, I had a lot of confusions because I can see that needle bumping. I used to think, oh, that's my pulse, right? But and there are a lot of noises around, and you will hear your pipes moving, your fingers, your knuckles through stethoscope. But you need to wait until you get the actual pulse. Practice, 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 and that will make you perfect in taking the blood pressure. And I will also add the video that I created about the rules. for taking the blood pressure in the same video. And please comment. I haven't mentioned the blood pressure that I got, the blood pressure reading. You need to comment that reading after watching the video and let me know what was the actual blood pressure. Okay, thank you so much. Have a good one. Bye.